Hello friends, in this video we are going to see about what is depression, what are its signs, symptoms and its complications, what are its causes, what are the treatment modalities available for it to cure it. That's what we are going to see in this video. So depression, to explain in simple terms, when you and your own thoughts become your own enemy, that's called depression. That is, you are always thinking negative, always your mood is low, so you are not at all happy, then that's called depression. Although there are various of diseases in this entire world, you may know, like cancer, diabetes, hypertension, heart attack. This depression is the leading cause of disability worldwide. Even though we may suffer from various diseases, it may not affect our day-to-day life. But depression is a disease which causes greater disability than any other disease. Worldwide, about 3 crore people are affected, and about 8 lakh people suicide every year because of depression. So what are the signs and symptoms of depression? Feeling hopeless, guilty or worthless or helpless, and disturbed sleep, like uh, taking long time to sleep or waking up in the middle of the night, and depressed or low mood all the times persistently, change in appetite, not feeling hungry at all or always feeling hungry, either increased weight or decreased weight, always having suicidal thoughts, making suicidal attempts, and decreased energy, even though if after feeding the energy level is normal, even though after waking up also we feel completely tired, fatigued, and difficulty in concentrating on things, difficulty in doing day-to-day activities, difficulty in remembering, loss of interest in doing our hobbies, loss of interest in doing whatever the things we like to do, not feeling happy even though we do things which we actually like. So usually these symptoms, like in every home, we have fights with father and mother. Something, always something goes on. Like, but we do feel the same symptoms. But are we actually suffering from depression? Definitely no. So to diagnose someone as depression, these symptoms should be persistent for minimum of 2 weeks continuously, and apart from that also, it should affect their day-to-day life. We may fight with our father and mother, we may go to school, we may read, we may do our day-to-day activities in an absolutely normal way. Then that is not at all depression. That's the low mood we are facing at that only particular point of time, and rest of the time we are completely normal. So that is not depression. So pathologically, like very few factors like genetic factors, very few diseases or drugs causes depression. Just all of the things are like our own mind is against ourselves. So these diseases, these things can be actually cured just by psychotherapy and lifestyle modification diet. And actually they don't need drugs at all. And one more thing is, depression is 100% curable. Everyone can come out of it as soon as possible. So what are the usually causes or risk factors for depression? As we know, genetic factor is one of the important factors. If any of our family members have suffered from depression, we have the chance to get depression. It's not compulsory, we have the greater risk. And female gender usually has twice the risk of the male gender. And any other major stress, trauma, any accidents, any life events like any love failure or any other things like any divorce, all those things, work pressure, any loss in the company, and all those things can lead to depression. And socioeconomic status, always being poor, always being neglected by the people around us, always being uh, always hearing negative words, always doing all the negative things, will lead to depression. So certain chronic medical conditions like dementia, Alzheimer's, which are related to brain, like epilepsy, Parkinson's disease, stroke, or other diseases like cancer, because of the disease itself they may feel depressed. And obesity or overweight is also a risk for depression. Certain medications like proton pump inhibitors, antihypertensive analgesics may also cause depression. So in my opinion, if you generally ask me, uh, what are the various reasons for depression being prevalent so much in these days, which is not at all known before 100 years? So one thing is, the first thing I would like to say is about parenting. I would like to cite one of my life events. When I was like about 5 to 6 years old, I while sleeping in the early morning, like around 7 o'clock. Then I ran to my mother and told her I fall from the bed, and I started crying. My mother didn't notice me at all, and she kept on cooking the whole thing. So after some time I stopped crying and I went away. So if at that point of time some others you attention, like what happened to you, they pay over attention, like how you got injured any places, can we go to doctor, if you pay more attention like that, the child may not actually develop the mindset to actually may not get to the mindset of facing minimal pain. If you if you if you grow your child in very comfortable zone, they don't know the outside world at all, then that's a major risk factor for depression. If a child runs from the bedroom and comes to the kitchen and speaks with his mother in a normal way, we should understand that he's completely fine. It's not going to kill him. It's not going to do anything to him. A mild pain will be there for the next few minutes. That's all. After that, everything is going to get cured. That's what you should know, and you should not give positive feedback to all those negative things. So parenting is one of the important things. The next thing is about socializing skills. Right from childhood, we should socialize with everyone. We should not be criticizing others. Parents should not say you should not speak with them, you should speak with them like this. They should not segregate people like that. They should let their child socialize with everyone. They should, like, how can they initiate conversation? They can encourage others, they encourage the good habits in others. They can hear their stories from others. They should have like good listening ears. So these things will encourage, these things will prevent depression. And the third thing is spirituality. So whatever the things we are facing in our life, it is nothing beyond what we can bear. So God is going to give us something which we can actually bear only. He is not going to stress much upon us. And one more thing, if you get something beyond which you can manage, see it as an opportunity. Like it's an opportunity to come out of your comfort zone and grow yourself in a greater way. If you are living in a comfort zone, like doing things which you are feeling comfortable with, then there wouldn't be any growth at all. So if you feel anything greater than what you can actually do, then take it as a good opportunity and try to come out of it and make use of the learnings from that and grow much more possible. So the next thing is feeling boredom. For example, if you take during the COVID times, there are a lot of webinars having about COVID and mental health, mental stress, how to overcome all those things. The one thing, the main reason for the mental stress is, one is because of the disease per se, and one more thing, almost all of us are not going to any jobs. The job security is lost, the economic security is lost. So because of that, we may feel depressed. So actually there is some reason to feel depressed, but why it is becoming so massive means we are not going to any job at all, so we don't have any time. So in the day of 24 hours, apart from the time we sleep, like except the 8 hours, the rest of the 16 hours we are going to see about COVID. When we switch on TV, we are going to see about COVID. When we see the newspapers, we are going to see about COVID. So constantly we are thinking about COVID, so constantly thinking about our job, constantly worrying about the future. So this becomes a vicious cycle which feeds us back with the negative thoughts again and again. So this is one of the main reasons. So if you have developed a side hustle, or if you have developed a good habit, if you have started learning a new skill, definitely this won't be much depressive. It's as simple as that. They have given very simple precautions like wear mask and maintain social distance, use hand wash and hand sanitizers. That's all. It's so simple as that. But only as we don't have any work at all, that gives a major reason for us to think about the negative things constantly. So develop good habits as far as possible. Book reading is very good habit. Start learning new things. Start speaking with people. Because of the work pressure, work time, you would not have invested in your relationships with people. You would not have concentrated health at all. Eat healthy food. Try learning some new exercise. Try watch some videos. Learn some new things. So that will be a good option. So, and the next thing is low self-esteem. From childhood itself, he would have grown in such a way only, like feeling that he's low when compared with everyone. He's not useful at all. Always playing the victim game. He feels comfortable being a victim. Always feeling pity about their own self. So actually, there is nothing to pity about one's own self. The deaf people, blind people, dumb people, there is all the differently able people create wonders in this entire world. So when compared to ours, there is no reason to feel pity about our own selves. And life is there is constantly growing phase in the life. Like we are not going to be stagnant at any point of time in life. At some point of time, we may be in a situation of pity. Like when we are in an unexperienced state, we may be a victim at that time. But it's not a constant thing. There is an opportunity for us to always grow. So always come out of that. Don't feel comfortable being a victim. Don't play the victim game. Don't feel pity about yourself. So, and the next thing is uh, surrounding ourselves with all the negative thoughts. Always, for example, some bad event happen, like some love failure happen, means always hearing the sad songs. Always speaking negatively with the friends about those things. Always speaking with those friends who say that you are actually pity. It shouldn't have happened to you. So those friends that support you, support that environment, always posting the sad quotes, love quotes in the WhatsApp status and all those things, always seeing the social feeds with those negative things at all. So if you constantly feed your mind with these things, then that is going to constantly repeat it in your mind again and again. So instead, surround yourself with positive people, always think positively, have positive thoughts, speak positively, do positive things. So I still remember that during my second year, the first day of the psychiatry class, my doctor psychiatrist called Nirmal, he asked, "What is psychiatry?" He asked everyone. So I still remember that I said, labeling a patient who doesn't have any disease as they have some mental illness and giving them some drugs and making them a diseased people is what is psychiatry. That's what I told. He told, okay, that's a good perception. He didn't say anything about that. But then later on I realized that there is actually something called depression because of the chemical soup we are having. Like our brain has lot of chemicals to which reacts in a different way to lot of positive chemicals and negative chemicals. So during depression, our mood becomes low because those chemicals which are responsible for happy mood are actually lost. So by our day-to-day practices, our lifestyle, food, diet, exercise, all those things, we can bring a positive chemicals in our brain. So this is a separate thing called Achar Rasayana, which we will see about it in a different video. So now let's come to the actual thing. If you are actually biologically, if you are ill, there are a lot of things like medicine, apart from psychotherapy, medicines, electrotherapy or electroconvulsive therapy, simply called shock treatment. All those things are available. Even certain kind of depression are resistant to drugs also. But for most of us, it is like simple lifestyle changes we can actually overcome it. So the first thing is exercise. The exercise produces the positive hormones, which we were actually speaking about, like endorphins, serotonin, and all those things. Dopamine are actually produced by good amount of exercise. If you ask me what exercise you can do, exercise is as simple as like if you walk for 30 minutes. No, if you walk for 10 minutes also, it's an exercise. But if you are very young, it's not advisable to do as simple exercise as that. You should utilize all the parts in your body. You can learn, like this is an information age, you can learn anything from home. Start learning new things like yoga, Zumba, dance fitness, pilates, Tabata, and all the things. Everything you can learn, like there are a lot of apps, you can go to gym, and all those things you can practice, which will actually utilize all your muscles, will increase your flexibility, strength, stability, all those things will be increased. But if you just walk, means it's not going to be any use. It will be just physical activity. So whenever possible, make exercise as a hobby, make it as your lifestyle, learn new things about exercise. So, and the second thing is diet. So, as far as diet is concerned, the standard diet is only one thing: limit the amount of fat you eat, and eat the right kind of fat, like polyunsaturated fats and monounsaturated fats, instead of trans fats and saturated fats. So, avoid like refined sugars, processed foods, sweets, starchy vegetables like potatoes and all those things. Processed foods like meat and all those things, you avoid it. So eat as much as possible. Eat lot of fruits and vegetables, which has a lot of antioxidants and fibers. So apart from that, eat whole grains. So that will improve your capacity and also increase the food items that are rich in omega-3 fatty acids. Omega-3 fatty acids have proven to improve our mood. So usually they are rich in fish. Apart from that, they are rich in nuts and all those things. Avocado. So apart from that, being exposed in sunlight is one of the factors. Sunlight is something which gives us energy. It improves the vitamin D levels in our blood. So this is a definitely good thing. And one more thing is sleeping in a proper way. If you are deprived of sleep, definitely you are going to feel depressed. And sleeping at the right time, not waking in the night for so long time or disturb sleep, and all those things are going to cause some kind of stress in you. So if you correct your sleep pattern, if you are following a good sleep hygiene, then definitely that is going to heal your depression. So friends, I hope that you have learned something new in this video. See you in one another useful video. Until then, it's Aravind signing off. Bye.